Hello and welcome back to Pharma Pro Mastery Hub. If this is your first time, you're welcome. This is a place where pharmacy meets mastery. Today, we'll be looking at the drug Ketorolac. Ketorolac is a powerful NSAID used for short-term management of moderate to severe pain. It is a potent analgesic with minimal anti-inflammatory effects. The drug is rapidly absorbed when given orally or intramuscularly. The peak plasma concentration is reached within 30 to 50 minutes of administration. It is important to note that compared to ibuprofen, it has minimal anti-inflammatory effects. So let's look at the mechanism of action. Ketorolac inhibits cyclooxygenase enzyme that's both cos1 and cos2. This leads to a decrease in prostaglandin synthesis, which will in turn lead to a decrease in pain, inflammation, and fever. Now, its cos1 inhibition is very strong, and this explains the high risk of gastrointestinal bleeding. Remember, cos1 has cytoprotective effect. So when there's a strong inhibition on cos1, it leads to a loss of cytoprotection, which in turn makes the stomach vulnerable, the gastrointestinal system vulnerable to bleeding. So indication for the uses of Ketorolac. Ketorolac is used for short-term management of moderate to severe acute pain, especially post-operative pain, severe dental pain, musculoskeletal pain, acute trauma, or pain requiring opioid level analgesic but not opioid, and it is not used for chronic pain. So let's look at dosage and route of administration. Ketorolac is given intramuscularly, intravenously, and orally. And for orally, it is only for continuation after giving intravenously or intramuscularly. So it is important to note, you don't just start Ketorolac. You have to wait till after injection. Duration of use is very important. The maximum total duration is 5 days. That's for IV, IM, and orally combined. Exceeding 5 days dramatically increase the risk of serious bleeding and renal injury. Remember, there's always a duration of use for most drugs. Contraindication. Ketorolac is contraindicated in patients with active peptic ulcer, history of GIT bleeding, aspirin hypersensitivity, for those that are in labor or post-delivery, and also is contraindicated when they are being used concurrently with other NSAIDs. Remember, do not just combine NSAIDs. As a pharmacist, you have to ensure that you ask the patient if the patient is using other NSAIDs so that you know which to remove and which to continue. Always clock your patient. This is very important. So like I said previously, I had to bring this duration of use again because it is very important. So the maximum total duration is 5 days, which includes IV, IM, and oral dose. Exceeding 5 days dramatically increase the risk of serious bleeding and renal injury. It is important, and that's why you are reading this again. Whenever you are giving an NSAID to a patient as a pharmacist, always counsel that patient. Now, these are warnings and precautions. Risk of for the gastrointestinal effects. There's high risk of ulceration and bleeding, and the risk increase with elderly patients, high doses, and prolonged use. Now, for the renal part, it can cause acute kidney injury, so avoid dehydration or renal disease. And for the cardiovascular aspect, it increases risk of thrombotic events, myocardial infarction, stroke. And then for the hematological part, it inhibits platelet aggregation, which will increase the bleeding risk. Drug interaction: avoid or use consciously with other NSAIDs. Do not use with anticoagulants like warfarin or antiplatelets, corticosteroids, AC inhibitors, or diuretics because of renal risk. It is important as a pharmacist that you know all this. When you are giving a drug to any patient, clerk, ask, and put this thing into consideration. And I believe a lot of these things are going unnoticed because their questions are not being asked. And when you ask the right question as a pharmacist, you are doing your patients great favor. So advice I give the patient, you educate them on that the drug is strong. Yes, very strong, like an opioid, but it is not for long-term use, it's for short-term use. They should not combine it with other NSAID. They should take it orally with food, and they should report black stools, vomiting, if they're vomiting blood, or if there's reduced urine output, they should report it immediately. It is important that you tell them this is a side effect to see. If you found this video helpful, give this video a thumbs up and share with your pharmacy cycle. Subscribe for more clinical gems right here on Pharma Mastery Hub, where pharmacy meets mastery. As a pharmacist, if you ever come across any of our videos, please ensure you know that patient safety is the first thing that you can do. Patient safety first. So do your best and give your best. Thank you.